This medical moment is brought to you by St. Rita's Health Partners, the region's leader in healthcare.
Welcome back to First Edition, and we are in the month of March, and many people don't know it, but March is actually Colon Cancer Awareness Month, and to talk a little bit about how we can prevent that type of cancer is Dr. Stephanie Dunkle-Blatter from St. Rita's Medical Center. Thank you so much for joining me.
Thanks for having me.
Yes, of course. So talk a little bit about colon cancer. How common is it in men and women?
Well, colon cancer affects about 1 in 20 of us. So it's a fairly common cancer. It's actually the second leading cause of death among men and women following lung cancer.
Okay, wow. And you know, with so many cancers, we can fight the battle better if we catch it earlier. So can you talk about, getting your checkups and your screenings done regularly?
Absolutely. In fact, colon cancer is one of the more preventable. In fact, we estimate that 80% of colon cancer deaths could be avoided if everyone was screened. And so we recommend screening for anyone over the age of 50. Risks for colon cancer include not only being over the age of 50, but having a family history, having a history of polyps in the colon, being obese, and having anti-inflammatory bowel disease. However, 60% of colon cancers are sporadic. In other words, there are no risk factors necessarily, and there are no symptoms. So that's why screening is so important.
Okay, so for most people, if you're over the age of 50, you're going to want to get your regular colonoscopy checkup. But if you do have a family history and colon cancer is prevalent in your family, you'll probably want to go earlier than that, right?
Well, what we recommend with family histories of colon cancer is you should be screened 10 years prior to when your family was diagnosed or when your family member was diagnosed. And then if you have a family history of colon cancer, you should have screenings every 5 years and sometimes more often depending on the findings. But anyone really over age 50 should start getting screened at age 50 and then every 10 years. And again, sometimes more often if we find polyps. We know that colon cancer comes from polyps. And so we can thus prevent colon cancer by plucking out these polyps in a colonoscopy.
Okay, wonderful. Great information. Thank you so much for joining us today.
Thank you very much.
We'll be right back.